With Tufaayo, we are saying you can either call in or you can walk in. So what are we saying? We are going to provide numbers that will be running on all our media platforms. And when you see that advert in a light green or a light blue color saying Tufaayo we care, you'll see numbers that follow where you can call and talk to someone if you have a problem. Don't just talk to someone about having a problem. You can talk to someone about just knowing more about mental health. What does it mean? What does it look like? So the mental health challenges we are facing as a nation are growing day by day. So May is Mental Health Awareness Month, and for us we are saying with Tufaayo, we are here to provide you with some services that will be available, that the lines will be toll-free, and we'll also provide areas or centers where you can walk in and talk to a mental health practitioner. Not just that, we'll be also having a healthy mind is not just only about work. There is also some play. We'll be also having some dance sessions, which will be provided to us by Soul Foundation. That's one of the things we'll be doing. But we'll also be having a mental health camp next week with our partners from the Uganda Parliamentary Forum.
We also have an outreach in the Mutungo area where we're going to visit youth who have been using hard drugs. This is injectables, heroin, crack cocaine, crystal meth, that really are struggling with the addiction. That is what keeps them where they are. But when you have a conversation with them, they desperately want to get out of it. They just do not know how. And when we speak to them, especially now that we have this Tufaayo campaign, what we see from them is that they are so desperate for connection with the people who do not seem to understand their challenge.
You remember about 3 years ago, there was a story that 14 million Ugandans are actually dealing with mental health. Now, I want to put context to that actually the 14 million Ugandans have an extra 2 people that are also dealing with mental health issues. Why? Because we have mental health carers. Those who are caring for patients who are dealing with mental health, they also get affected. Now, who speaks for them? Who addresses their plight? So we have to look at it holistically, that if 1 out of 3 is dealing with mental health issues, then the other 2 are also not spared.